Now I gotta find a new person.
You hear him crying? You hear him crying?
That's all right. I'm crying. I'm making money.
Give him my tooth. No stool, no chair.
Well, bring your own. Here.
Christ.
No, because these, I ain't letting nobody tear up these.
I didn't want to. I need to bring mine back in here. I gotta leave me here. Oh boy. It's like a puzzle. You see this puzzle I'm unraveling? Alright. Here we go, here we go.
Yeah. And I know what he is.
Hey, man. That's right. Welcome to the Couch Live here on WJHM102jams.com. I know you can't see me on Facebook Live right now. That's because I have to stand up until this chair comes back. Rock100DIZ.com. And, of course, the Problem Solving Network. Hello, everybody. Welcome back to the show. It's a beautiful Friday. Thank you, Sir Chris. So nice. Don't you just love when he's playing nice? Look at that sweet, kind face of his.
Yeah, right.
Yeah? All right. Anyway, I'm the Street Certified Dope Dr. Louis Delgado here with you on a beautiful Friday along with my cast of friends, the Dharma guy, Trinity Phillips.
What's going on?
Oh, that sounds like a song. Let's go. Is that the air? That's what it is. You notice he made it a yellow light instead of a white light?
Yes.
That way I don't have to turn it off?
It's like a bug light now.
Oh, yeah. Makes me want to not go to it. Then, of course, we have our intern, Robbie Barrett.
What's up, guys?
What's up, Robbie? See, Robbie? You see, there you are. On Facebook Live as well. So if you
Be seen, boy.
Be seen. So if you are listening, you're listening on one of the radio networks, or if you're on watching it, then you get to see our young intern, Robbie, here, sitting over there with Trinity on the airplane seats over there.
That's right.
It's nice over here.
Nice.
As long as somebody doesn't come and like try to rip us out and beat us up.
Right, right.
Well, we're not on United or
Yeah.
Delta is the other one.
I don't think that's happening to you.
No.
Just a guess.
I think I give up a little bit more of a fight.
Just
probably.
guessing that that's not going to happen to you. Got a show planned for you today. We're doing an interview today, right, Robbie?
Yeah, it's 12:30. If you're still listening, then we got Dr. Eric Edwards, the co-founder of Kaleo Pharma, coming on talking about the naloxone auto-injector called Evzio.
Right. It's this thing.
And of course they're going to be listening then because they love us.
It's this thing. Yeah, the
that's
Evzio. Now we know that's the real way to say it. So all you physicians out there that call it Evzio,
You're wrong.
that's right. And you even corrected your own physician, didn't you?
I love they love that too, by the way.
Yeah. Physicians love when you correct. So this is the Evzio. We're going to play with this a little bit later on. And so, because you've heard us talk about this product, which is the Narcan, and want to make sure that everybody understands we're really talking about the same chemical, right? We're talking about naloxone,
Yep.
which saves lives, but it's a different product. So there's two different products out there that we know of that are on the market. As long as you have some, I don't care which brand you have.
Exactly.
But we're going to learn more about this one today.
And why it works. And big thank you to Kaleo for giving us all these trainers.
Yeah.
Everyone's got one.
Yeah, we all have one. Yeah, look, we all got a little trainer. And we're going to play with this a little bit later
I feel
on.
trained.
What's up, Steven? Greetings from Ohio. That's right.
I do think it's interesting though, because he gave me mine when we were outside,
Yeah?
and you and I asked the exact same question. It was like,
Is there a needle?
There's no
Yeah.
needle in here.
Well, I just want to make sure,
Inject myself.
check myself.
I was messing with it on I think last Friday when I got them, and I took the cap off and put it on me, and I got a little pinch. So I thought
No.
I thought it had a needle. Yeah, I got these red marks. Right?
That's funny.
Yeah, you're supposed to use it on your thigh, not your.
Oh, okay. I gotta position this for Facebook Live. Trinity, this thing right here is just in your face. See this little block?
Nobody needs to see me.
This little Captain and Company block that doesn't seem to. I'm trying to see if there's a way to take it off. No. We want to see you, Trinity. And then, of course, hello, Vanessa. Hello, Elsa. Welcome to Facebook Live. Anyway, so let's get into it. So this is a show that focuses on addiction recovery and everything in between. We get a little off topic, of course, because that's what we do. It's hard to stay focused on one thing.
Never.
And there's always something going on. I mean, right now the social workers are meeting here in Orlando.
Really?
There's a social worker conference.
I didn't know that.
So if you want a heart to bleed for you, they're bleeding right now.
There's always a conference or something here in Orlando, though.
There's another one. I think FAT is next week, I think.
Wow.
Yeah, so there's always something going on here in Orlando. That's good. But yeah, I know some people are in town for that, so that's cool. LCSW licenses, I think, a really cool license. If you want to be in this field of addictions or therapy and treat people, that's really a cool one to pursue, an LCSW. The social worker degree prepares you really well, and the license is really good. I don't know, just seems to be some really cool people. So they're here in town right now. So what else is going on, Rob? You got some news for us. Let's get into it.
Yeah. I saw a study that came out this morning, actually, that they officially found out that I think 54,000 people died from opioid overdoses. A lot of them were fentanyl, of course, that everybody's hearing about. And that number, 54,000, is more people than that died in the Vietnam War. So more people died of overdoses last year than died in the Vietnam War, which is kind of a staggering statistic.
How many people died in the Vietnam War?
I think 52,000.
So and we're at 54,000 with...
That was in 2016. And they say that the numbers are higher so far in 2017.
National.
Yeah.
Yeah, but the sad part, that's just 1 year.
Without the benefit...
That's not including the
yeah, exactly. Vietnam was a lot of years.
Yeah. And that's everyone that's reported. I mean, there could be more people that die with other stuff in their system that, I don't know.
It's a lot of
comorbidity stuff. Yeah.
Yeah, it's real sad.
So what you're saying is the opioid is a problem.
Is that what you're saying? It's an epidemic, I think.
Wow.
Yeah.
Wait, are you saying that the opioid overdose is an epidemic?
Yeah, we should do something about it.
Really, man. Like, since when?
You better wake somebody up.
Yeah. Knock on some
We should do a
doors.
study about that.
Yeah.
We should do a study to see.
This is so sad, man. It's so sad. You know, it just keeps beating numbers. Every time a new number comes out, it just beats another number, beats another number, beats another number.
Yeah.
And it really doesn't matter how much you talk about it. There's still a lot of unknown and a lot of ignorance.
Yeah. I mean, and with other addiction stuff out there, I usually see like numbers have finally started dropping, but this it just keeps going up ever since 2013.
Yeah.
It's just, you look at a graph, and it's peaking.
Yeah. And hey, Darian, I see that you're on Facebook Live. How you doing? Hi, Darian. We love Darian.
Yes, we do.
Haven't seen her in a while.
Hey, Darian.
We have not.
Darian's part of the foundation.
I feel neglected.
Come on, Darian, you got to make it your way down to
cool.
Central Florida. You know, you got to come down.
She's all high society now, man. She
Is that what it is?
Yeah, she forgot about all of us down here.
Ocala is high society?
Well,
She's riding them horses.
there you go.
Right there, riding them horses.
Get along, little, don't you?
Yeah, all right, so that's one news that people are still dying. Thank you, Robbie.
You're welcome.
Because, you tell us when that number goes down, Robbie.
Yeah, but way to start our Friday out, man.
Yeah, way to start off with a positive message.
I think all the past 3 Fridays when I've introduced something, it's been negative, and that's been the feedback. But you got to be real about it sometimes.
Yeah.
Sure.
Maybe we ought to make that a prerequisite. Robbie has to come up with a positive, a negative, and a neutral.
Yeah. Because I heard some of the other ones he's going to bring up, and they're all kind of not positive either.
No.
They're not positive either?
I don't think so.
God, can we just... Here's the positive, folks. Recovery is possible.
It is.
That's the positive. The positive is people do recover. It's just... we don't have those numbers.
Every day it happens, though.
God, I would love to hear that number,
Yeah,
Robbie. How many people last year
got
into recovery?
I don't know.
And it's because it's a one day at a time. So, what would constitute recovery? You know, like I guess you would have to say how many people last year completed 1 year of successful recovery. It would have to be something like that.
That'd be cool.
Yeah.
I wish we had that number. If anybody knows how to get that number, how many people last year got 1 year? How would you even get that number?
I don't know. Through treatment centers, you'd think, and follow-ups, that'd be one way.
Treatment centers can lie.
Yeah, well, of course they can.
Haven't you seen these treatment centers that say we have an 80 to 90% success rate?
Yeah.
What the hell are
No,
you?
you're right.
Haven't you seen the treatment centers that say we have the cure for addiction?
Yeah.
Well, you have the cure. Why are you holding on to it? And why do I have to buy your book to get it?
Yeah.
I mean, if you really have the cure,
Call me now.
call me now. I know, because I wasn't at it. Well, you know what? A lot of us were. I'm sure I'm not going to go around and say that. You know, I'm just grateful for where I'm at right now. All right, what else is in the news, Robbie?
Well, I mean, we have the whole Tiger Woods thing to talk about. We have a couple.
Oh boy, Tiger.
What's the
Tiger,
latest
I
on
love
that?
you, Tiger.
The last I heard, I mean, I think that initially everybody thought it was a DUI as far as alcohol, but I think it's come out
That was the
since
initial
it was a mixture of medications that he was prescribed.
Yeah, but his BAC was 0.00.
So he did test.
Yeah, no.
100% he blew.
Yeah, he blew.
Okay, I thought he refused to blow. He blew.
Yeah, he blew.
And he blew zeros.
Yes.
So do we know now if it was like accidental or if it was purposeful.
He said it was prescription medication, but
Well, you could.
I know what he said, but
Yeah.
I mean,
No, you can look at his face and know that
Yeah.
it was something.
Yeah,
Trinity.
of course, absolutely.
They Drew be like
looked like
I guess what I'm
some
trying-
benzodiazepines to me.
Well,
either
yeah,
benzos or opiates,
Yeah,
Where-
or a combo.
or muscle relaxers, and all, or a combination of all three.
But has it come out yet if it was, if
Yeah,
it
good
was
question.
abuse or if it was
Good question.
legitimate prescribed behavior that there's oversight on the doctor's part? Like,
Yeah, what's going on with that, Robbie?
I know that was
Anything-
his claim. I believe he was trying to say
Yeah.
it was an adverse reaction.
That's exactly
I didn't know
what he
this was
said.
happening, but I wonder, things typically come out, so I'm just
Right.
not sure.
He hasn't. I don't think he's really had like a press conference. Kind of trying to keep on the down low. I think everyone's kind of questioning it. Does he have an addiction problem? What's going
Right.
on? I saw a lot of people on Facebook said like this is the first real sign that you have something. Go get help. But who knows?
Like, let's not.
First
Yeah.
sign, like-
The first. How about when his wife has beat his car up with a bat?
Yeah,
Yeah, that's
That
pretty
might have
bad.
been-
I think that was the first sign that there's inappropriate something.
Yeah.
Better be careful about some behavior.
Yeah.
But no, here's my concern with this. First of all, Tiger, you're very lucky that the president makes a lot of news.
I was just about to say that too.
You can't have a better wag to tail.
Yeah, he's loving Trump right now.
Because that way, Tiger's like, that's not even news when you have Comey getting talked to.
Yeah,
you know what I mean?
he's
That's
so
not-
far on the back page right now.
But anyway, so Tiger, we love you, man. We're Central Floridians. I've been around you for a lot of years. I've seen you many times. We're not friends or anything like that, but I've just watched you for a lot of years, and just I'm concerned. Here's my concern for not just the Tigers, but the Tigers of the world, meaning people of the world that have had some sort of legitimate surgery. This is not a new narrative here. When you have surgeries and you've had as many health problems or physical problems as Tiger's had, he is susceptible to becoming addicted to these opiates or benzos or whatever he's taking, the muscle, like whatever it is. Now, I'm not saying he is. So I think everybody should just relax a little bit. He's a little bit easy to target and to attack because of who he is.
Yeah.
But just remember, this is everybody's brother, sister, grandmother, niece, nephew, whatever, that has a surgery, gets on medication. And to think about how many of you out there have been placed on some medication, but you may not have changed your driving. You may not have changed, this is the same as drinking, I better not drive. Now, some of you have, but some of you haven't. Now, as far as what time it is, and that's where all the things get, because it was like, 3 o'clock in the morning?
Yeah.
So, but when you're creeping, and if he was creeping, you got to get home. I mean,
Yeah.
So, I mean, it's unfortunate, it's sad, it's something to look at, but let's not jump to conclusions, because again,
remember he's a
we don't
human
know the
too.
story.
He's got children and like
it's just like everybody else.
pump your brakes a little bit, people.
He's probably got a lot of children.
Oh, Robbie!
Sorry.
Man, the views and opinions
Robbie.
expressed by Robbie here is not the.
I him. He
Yeah,
said that.
yeah.
But anyway, no. But but there's people. He's got loved ones. He's got friends. He's got family members. And you know what? He's not the only one that has done that. And we can't look at the time. We don't know why he was out, and we don't know what the deal was. I love that he blew zeros. So at least we know he wasn't mixing alcohol with the medication, because we know what that'll do.
Oh yeah.
We constantly want to tell people, don't mix alcohol with your medication right after a surgery or anything like that. Be very careful with what you mix alcohol with.
Yeah.
For those of you that are non-addicts or alcoholics.
Yeah.
But as far as what's going on with him, we'd love to hear about it, because you know what, Tiger, people need to know, just to be a little bit more aware about the prescriptions they've been getting, and how to make sure to monitor their travel properly.
Well,
Not just tired.
Yeah.
Right.
A lot of people drive tired. I've driven tired. Have you
Yeah.
ever driven tired?
Yeah.
Where your
Fall
eyes are
asleep
kind of
at
like, yeah.
Which
Fall asleep.
statistically is actually worse than
Yeah.
the truck driving.
I've driven many times where my eyes are like, whoa. You know what I mean?
Yep.
And I'm thinking, all right, I just gotta wake up. Where it has nothing to do with substances, nothing to do with medication, just tired.
Yeah.
So you mix a little medication in there with just 3 o'clock in the morning, everybody's pretty much tired.
Yeah.
Here's what I would be worried about. If you pulled him over at 3 o'clock in the morning, his eyes were like this. Then I'd worry, right?
Coffee.
Then I'd be like, hey, Tiger, whatever you're on, bro,
Yeah.
back it down.
Yeah.
So, anyway, good luck.
I will say that he's still got fans. I, for one, am a fan.
I'm a
me,
fan.
Yeah, me too.
I still want to see him do well.
Dude, to me, it's like, back in the early 90s when baseball went through its strike, I haven't watched baseball the same ever since.
Right.
I haven't watched golf the same ever since Tiger's
I
been
don't
out.
think anybody
Yeah,
has,
me
man.
neither.
I mean, it's just not the same game.
I think everybody dropped off.
And I love golf. Don't get me wrong, I love golf, but there was something about watching somebody that phenomenal
Sure.
play that just made it damn interesting.
Yeah.
Yeah.
You know, not that there's not great players. Don't send me any messages about that because I know there's a lot of great players, but you know it's true. You know the Tiger numbers are up here for ratings. Always has been.
Of course.
Always has been.
Well, I remember when we went to Bay Hill that one year, when you know, there's people following around all the different golfers.
Right.
And you see each one of the golfers, like Phil Mickelson and Bubba Watson. They had a pretty
Right.
good little crew.
Yeah.
And all of a sudden you look over and you see this huge concert
Yeah.
type crowd that's just following Tiger from hole to hole.
Dude, I have media credentials for Bay Hill every year, and I'm telling you, that crowd is bigger than anyone's, even no matter what day it is, Thursday, Friday, Saturday, or Sunday.
Huge.
And Vanessa says a good thing. Vanessa Bornos from Tampa. She's an attorney in Tampa. It says it right there on our Facebook Live page. It says if you gave a urine sample, the lab results will reveal all substances, and that's an actual truth.
Yep.
Thanks, Vanessa.
So hopefully he did.
Yeah.
We don't know if he did, do we, Robbie?
No.
Robbie, you know you're
Not
allowed
yet.
to call these people, right? You're media.
Yeah. I
You
need
can
to. I
call.
need to.
You need to get on the phone and call these places up that you know, because a lot of this is public information.
Yeah.
They'll give it to you, Robbie.
Yeah.
So we gotta teach them how to use the power of media.
There you go, man.
Robbie will get in those
You
doors.
gotta call up, use some bass in
Yeah,
your
go
voice.
sit with Tiger.
You know who I am?
All right.
Yeah, go
Yeah.
tell him I'm Robbie.
Yeah, I'll get him to sit in between me and Trinity next week.
Yeah, he can fit right now.
Come on, Tiger.
Because I'm sure he's not as diesel as he was.
Yeah, come on, Tiger.
That boy, when he's diesel, he's diesel.
Yeah.
It's a thin man, but he's strong. Courtney says what? What does Courtney say? Let me see. Oh, she just shared the video.
Oh, thanks,
All right.
Courtney.
Yeah, thank you very much, Courtney.
Right on.
Courtney, I was calling you. I was trying to get somebody into treatment. I need your help to deal with this one special situation. But we'll deal with that off the air. Anyway, all right, so that's that story. Tiger Woods, wish him the best. Pray for him, love him, all that stuff. That reminds me of what, neither one of you went to the conference the other day.
Nope.
Orange County, we did a really good, I think it's our best
Yeah,
yet.
I really wanted to go to that one.
It was our best yet, man. Our boy Daryl Strawberry was one of the not only attendees, but he was one of the panel members. Karen Shrapek, one of our friends and part of our board. So two of our board people were there. Two of our advisory council members were there.
Because you were there.
Oh, that's right. Me too. So there we go. Three of us were actually there. So Daryl, Karen, and myself. And let me tell you something. In Dr. Huckabee, I have a huge amount of respect for you. Timothy Huckabee, great physician here in town. And he's with Advanced Recovery Systems. And let me tell you something. He was so open about his own story and his own addiction and recovery that it brought it all together. So you had Dr. Timothy Huckabee talk about, using fentanyl on himself.
Wow.
And while, operating. You know what I mean?
I've heard that from a lot of
from a
people,
lot
yeah.
of physicians, right. Then you had Daryl Strawberry talking about his substance use and his recovery. And then you have Karen talking about her issues with her stuff. I mean, it was just really powerful. And it was all about breaking the stigma. So thank you to everybody that participated in the treatment conference the other day. It was phenomenal. Great stories had, and great discussion about breaking the stigma. We're just going to crush stigma all year.
Yeah.
That's the deal this year, right?
Yes.
That's our
Yes.
big focus is crush the stigma, smash the stigma, break it, whatever you want to say. But anyway, so that was a great conference. But anyway, I just bring that up because there's another great story about it.
12:30.
It's already 12:30.
Yeah.
All right, what are we going to do at 12:30? Tell everybody.
We're gonna
about
call
it.
Dr. Eric Edwards from Kaleo Pharma.
He's a doctor.
Yeah,
He's a double doctor.
He's a PhD MD, which is really cool. He's a really smart guy. So
Overly educated.
yeah, we're gonna get to talk to him for.
He's got a lot
A
of
little
digits
bit.
after, or letters.
That's a lot of letters.
Yeah.
MD Food, MD
Yeah.
PhD. That's awesome. All right, so Dr. Eric Edwards, and who is he?
He is the co-founder of Kaleo Pharma.
Okay.
Yeah,
And
and they're the ones who. We're grateful that they send us these trainers of their
They
product
talk to you.
Evzio.
Yeah,
Yeah,
let
they
me see if
they
we can
talk
get-
to
let
you.
me just put it up here. So.
Yeah.
This trainer contains no needle or drug.
Here's the number, Louis.
Uh-huh.
That's awesome.
Wait.
Ready to use.
There you go.
Pull off red safety guard. To inject, place black end against outer thigh. Then press firmly and hold in place for 5 seconds.
Wow. How about that?
5,
Ouch.
4,
Whoa.
3, 2, 1. Injection complete.
And they're revived.
I think I just found my new intro.
Just like that.
I'm alive now.
Don't we have a countdown on our intro?
Oh, yeah, that's a good idea.
I want that. Wait, I like that countdown. Wow. So it talks to you now. The only thing is, when you're in that paranoid situation, when you're just all tripping.
Who's talking to me?
Yeah.
Yeah, it's hard to hear that.
Yeah, well, I mean, I just, hey, whatever it takes, I guess. All right, let me see if I can get this right. Me and these digits over here. Hey, hold on.
Yeah, I like the talking aspect though.
All right, hold on. There's the number.
Plus.
Oh, starts with a plus.
Yeah.
That's a lot of numbers.
Wait, is he overseas or something?
I think he's in Virginia or something.
And he's going to answer this directly? It's like a toll-free number?
And then there's a password.
Enter your meeting ID followed by the pound or hash sign.
Whoa, that's a long password.
So this isn't like a cell number or something?
This is not a normal call-in.
No.
This is like the
top
football.
stuff.
Yeah, I got the football.
If you are the meeting host, please input your host key
Why not?
followed by the pound or hash sign. If
Answer
you are
that?
a participant, please press the pound or hash sign to continue.
Yep.
Press pound.
Press pound?
Yes.
Yep.
You are in the Zoom meeting now. There are 2 participants in the meeting.
Oh, wow.
He's waiting for us.
Beautiful. We're in. Hello, welcome to the Couch Live. You're on the Couch Live with Street Certified Dope Dr. Louis Delgado, Trinity, Phillips, the Dharma guy, and of course, our intern, Robbie Barrett. Are we speaking to Dr. Eric Edwards?
We are. Good afternoon to you.
Good afternoon, good afternoon. And who's the other? It said there's 2 people here. Are we allowed to know who the other
I
person
think
is?
it does.
Is that a secret?
It's a secret.
It's just just one of the member of our PR team.
Oh, fantastic. Just to make sure that we do everything correct, right?
Awesome.
I love it. Dr. Eric Edwards, first of all, thank you so very much for talking to us today. We think it's fantastic, and we're very honored that you took the time out of your day to speak to us here on the show. We're a show that focuses on addiction and recovery. I don't know how much you know about us, but we've been on since 1999 doing this, and so anytime there's any kind of treatment center or agency or facility or business that comes into this space and is trying to help reduce some of the problems that we have, we're always eager to speak to you and just to see how we can help you, because you're obviously helping us. So thank you very much for that. Now,
No, thank you.
all right, so we got a phone call from, what was it, Mark Poor?
Mark Poor.
Mark Poor is originally the guy that reached out, and he knew that we did a golf tournament this year, and at that golf tournament we gave out 108 Narcans, which is also naloxone. And after that, Mark calls us up and asks, well, are you married to Narcan, or can we talk about something different? No, he said it differently than that. But anyway, so we found it very interesting and wanted to let you know, no, we're not specific about any particular medication. Both of the medications are both naloxone, and we were very interested in yours because yours was the first one we actually saw at the Heroin Task Force meeting. Was that what it was, Trinity?
Yeah. That was the one that
David Siegel had.
David Siegel had. Yeah.
David Siegel had it originally from Westgate Resort. So I'm going to start with you. Can you tell us a little bit about? You're one of the founders, or the founder. Is it the founder or one of the founders?
I heard it was one of the founders, but I'm not.
I'm one of the founders.
Okay, so how did this come to be? Why this space? You guys do EpiPens, right?
We have the number one competitor to the EpiPen auto-injector, and that drug is called AubiQ,
Okay.
which has an interesting backstory as well.
All right. Well, tell us a little bit about that, because that talks about how you got into the space of pharmaceutical industry, correct?
It does, yes, sir. So when my brother, my identical twin brother Evan, and I were young children, we were diagnosed with life-threatening allergies to all eggs, peanuts, tree nuts, seafood, and many antibiotics. And as a result of that, as you know, we had to carry a potentially life-saving dose of epinephrine with us at all times. But like most individuals, we really struggled in being adherent to our doctor's recommendation that we have it with us, and unfortunately had a couple close calls. So my brother Evan, he went into engineering at the University of Virginia, and then I went into medicine. We're kind of left brain, right brain, mirror image twins, and then we decided to devote our careers to developing another option for patients who, like ourselves, have struggled with life-threatening allergies, and then that resulted in a credit card-sized auto-injector called AubiQ for the treatment of life-threatening allergic emergencies. In the meantime, I was also a paramedic. I've been a paramedic for almost 20 years now, and have dealt with unfortunately numerous heroin and prescription opioid overdose emergencies. And then when I was doing an acting internship in the ED, had a patient come in who had over 20 fentanyl patches on her back.
Oh my God.
She was over 60 years old, and after we revived her with naloxone, we asked her what had happened, and she said that no doctor, pharmacist, or a nurse had ever told her to take one patch off and then put another one on. So this was a true accidental emergency. My attending physician said, "Oh, we're seeing this more and more and more," and that was 8 years ago. So we decided as a company to invest in the research and development to develop the first community-based take-home naloxone product, which became Evzio. And that's kind of how we got into this space, was seeing that there was a true unmet need in the community where the various forms of naloxone had not been developed specifically for community use by untrained responders.
Wow. And what was the original response? Do you have a board? Do you have investors? Do you have somebody you have to answer to?
Yeah, so we're blessed to have an amazing team here at Kaleo. Kaleo is a pharmaceutical company. We're based in Richmond, Virginia. The name Kaleo means to be called or to have a purpose, and our calling is to develop medicines that are life-saving or life-enhancing, and that's why we came out with Evzio first as an epinephrine auto-injector, and then ultimately developed Evzio. So we have an entire board of directors. We have an entire team across the entire spectrum of what it takes to get these potentially life-saving medicines out there. So we have education specialists, sales specialists, finance, legal, regulatory, clinical development, R&D, all of those teams. But all of us are focused, as a company founded by patients, on really trying to improve access to potentially life-saving medicines like Evzio for the millions of patients who can use this, whether it's an opioid emergency brought on by prescription opioids or, unfortunately, brought on by struggling with an opioid use disorder and succumbing to heroin.
So what was the original response by your team when you brought up this idea? Because coming into the space of addictions, they can go either way. I mean, we've been on the air, like I said, since 1999, and sometimes you deal with real respectable companies that they just don't want to be associated with the word addiction at all.
Yeah, you're exactly right. And I think, through efforts like you and your show and others as well, throughout America, fortunately, I think we're starting to turn the tide a little bit of a recognition of addiction as a disease, and the recognition that this is a problem that we all need to lock arms together and come up with solutions. So fortunately, when our board and when our management team saw that there were so many individuals who were struggling with opioid emergencies, and that this disease does not discriminate. It impacts children, it impacts adults, it impacts individuals who are both using opioids for medical reasons, who might take too much or might have alcohol or some other drug for anxiety that compounds the problem and can lead to an opioid emergency, and it affects individuals who are in the addiction medicine arena. When we saw the scope of the problem, that's when it was very easy for them to jump on board, and we're just very blessed and fortunate to be playing a small role as we try to reverse this rising tide of opioid deaths in America.
Awesome. And can you, for the people that don't really understand naloxone or understand what kind of a life-saving medication this actually is, can you go into a little bit of that and explain that a little bit?
Sure. So when an individual is taking an opioid, and whether that's heroin or it's a prescription opioid medicine like hydrocodone, oxycodone, etc., that drug binds to certain receptors on the brain, and one of those receptors, called the mu receptor, can lead to side effects. One of those side effects, in addition to decreased responsiveness, it can allow you to be unconscious, it can also impact your breathing. And unfortunately, that can happen very quickly to the point where your respiratory rate starts to decrease very, very quickly to dangerously low levels. And when you don't get oxygen to the brain, your other organ systems fail, and that can lead to death if not treated quickly. Naloxone is a drug that can rapidly reverse that life-threatening respiratory depression, those life-threatening breathing problems that are associated with an opioid emergency, and can allow you to have that respiratory rate get back to normal very, very quickly, and then allow you to restore consciousness, responsiveness, and it works very fast. So in the past, that drug was only available via vial and syringe, and I would say other formats that were built and originally developed for healthcare practitioner use. Our thought around Evzio and our whole development program was, let's take this known safe and efficacious drug and then put it in a format that would allow even bystanders, individuals in the community, untrained individuals, to take fast, confident action in administering naloxone in an opioid emergency, especially given the fact that most individuals would be unresponsive during that. That was the impetus behind Evzio. Let's not wait for that ambulance to arrive. Let's try to get something in the hands and get naloxone on board before that ambulance arrives, hopefully improving the likelihood of a successful reversal and restoring life.
Beautifully stated, and you know what? This is the first one. Now I know why yours was the first one that I ever heard of on the market for the normal everyday person to even get. I think this is a good time, Trinity. Can you replay that, Trinity? Can you use that trainer again and let people hear what they would hear if they were in this situation or their loved one was in this situation? What would they hear the trainer or the actual product say?
Sure.
Because it speaks to you.
It does.
All right.
This trainer contains no needle or drug. If you are ready to use, pull off lead safety guard. To inject, place black end against outer thigh, then press firmly and hold in place for 5 seconds. 5, 4, 3, 2, 1. Injection complete.
Wow.
Just like that.
Just like that.
I'm alive.
Now, when I first heard that, I have to be honest, Dr. Edwards, I first thought, I've been in a situation where someone is overdosing in front of me back in the day, and I was panicking and feeling a level of anxiety and panic and just wanting to leave. I just wanted to run. What kind of feedback have you gotten in regards to the voice-activated thing and how much that has helped? Because I've heard people actually say it has helped. So can you kind of speak on that a little bit?
Yeah, I can. Thank you for asking. So, as you know, most life-threatening opioid emergencies occur in an out-of-hospital environment. They occur in that home and are often witnessed by friends or family members. And so our whole goal with the voice instruction system was to provide that voice and visual guidance that could help those individuals who may not have any medical training correctly use Evzio when they're first able to respond. And we know that studies have demonstrated that we've conducted showing 94% of users can correctly administer Evzio without ever seeing the product, without any training whatsoever. And the whole goal there was keeping other analogous medical products in mind, like automated external defibrillators. When you're in that panic situation, what do you have that can assist and guide a user through voice instructions, repeating the instruction until you do a task correctly through administering that product? And the response has been great. We have a lot of individuals who contacted us to tell us how Evzio has allowed them to take that fast, confident action during an opioid emergency. And most importantly, success for our company is defined by how we're doing in the community. And through our donation program, where to date we've donated nearly 250,000 Evzio auto-injectors, including several thousand in Florida, to first responders, health departments, and nonprofits, we've received reports that we have helped to save more than 3,600 lives with the help of Evzio.
Wow, that's a beautiful thing. Thank you for that, by the way. Thank you so much for that. Now, for those of you out there that if you heard, it said outer thigh. And I like that it said outer thigh because I know some people have the image of what was that movie? What was the movie? Pulp Fiction.
In their heart.
The Pulp Fiction, where the guy just stabs her straight in the chest. Yeah. Right. So this works similarly. In other words, the person will revive right away, but differently. Everybody that's listening and may use one of these products. After you use it, you still want 911. You still want the authorities to show up. You still want help, right?
Yes.
I mean, and that's the push: is that don't just revive your friend or your loved one or yourself, and then, you know, that's it.
Go watch TV or
Because especially with some of the stuff that's out there right now, with the fentanyl and the carfentanil, even other stuff, that you really want to get to a place of safety, a medical facility, as soon as you can, regardless. But this will revive them up immediately.
I do have a random question.
Go for it.
I just, maybe because we live in Florida, my first thought was, is there a Spanish version of this where it speaks in a different language?
Great question.
Yeah, it's a great question. Unfortunately, if you can believe this, in the U.S. right now, the official language of medical products is English. So we are able to provide Spanish materials, but the actual product only provides voice instructions in English. That being said, on the actual device, there are pictures of how to use it, and there's visual instructions to help individuals of varying languages. But it's a question we often get, and right now, you know, we are looking and working as a company to try to figure out what can we do to help make this product available and more easily accessible, and through communication means with the Spanish-speaking population. We just don't have that solution yet.
Thanks. Dr. Edwards, I have another kind of Florida-related question. So, people in Florida typically leave things in their glove box. Something like this, when it can get to over 110 degrees in your car, will the product stay safe, or what do you recommend for that?
Yeah, it's a great question, and it's also a common concern and issue with epinephrine auto-injectors that we talked about earlier in the show. And like that product, the goal is to ensure that you try to keep the product as close to room temperature as possible. That is the goal. So we would encourage, no matter what form of naloxone that you have, try to keep it in a cool place if possible. Try to have containers that can help protect it from extremes, whether that's extreme heat or extreme cold, and that's regardless of the form of naloxone that someone has.
Yeah, thank you.
On this trainer, I'm assuming that in lieu of the wording that's on this particular package, I'm assuming the other one has other wording. And does it have some of those indications and some of those warnings to temperature and all that?
It does, yes. In addition to that, great question. In addition to that, it speaks to what you mentioned, which this product's not a substitute for emergency medical care.
Okay, great.
It's really important that after use, they seek emergency medical attention. And in fact, the last prompt after you administer this drug, which can be administered, by the way, through clothing, when the pull can't down or anything like that, it can go through the seams of jeans. It's been tested through various layers of clothing. But when you administer Evzio to your outer thigh or to an individual's outer thigh, the last prompt says seek emergency medical attention, which is so important in case the drug doesn't last as long as you need it to, and there's just too much opioid in the system. An individual can experience an additional event of respiratory depression. So you really want to get EMS assistance there. And as you know, it's much more likely that those individuals also then are able to follow up and get the help that they need with the right addiction medicine specialist if they've gone through this experience.
Right, and that brings a couple of questions that we hear all the time. Number one being, what happens if you don't really know that the person is overdosing from opiates, heroin, or anything like that, and you give them and you administer this? What happens then?
Yeah, great question. So fortunately, naloxone only works. Its mechanism of action only works when opioids are in the system. And in fact, as a paramedic, when I was going through my training and treating many of these cases, and even as a physician, you see these cases, and sometimes you don't know what the offending agent is. You have no clue what the patient has taken, but they're unresponsive. So we used to give what's called the coma cocktail, which is for any unresponsive patient, you give certain drugs. So, for example, before we had glucometers to test blood sugar, we would give glucose, and then if they didn't respond to that, it's not a diabetic emergency. Well, one of those other drugs was also naloxone, where this drug is fortunately a safe drug to the tune of, if you do not have opioids in the system, then it will have no action. It will do nothing for the patient. It only works in the presence of opioids. And then obviously, if you do have opioids in the system, there are some adverse events associated with the drug that are associated with inducing withdrawal, etc. But we're talking about the potential for saving a life here. So obviously, its benefits and risks should be evaluated closely. If you think someone is hardly breathing and they may not wake up, you should administer naloxone as quickly as possible because it can be life-saving.
Fantastic. And then the other question that goes along exactly with that is the people, especially I hear this from a lot of people in the Ohio area that feel that some of the individuals there have been giving naloxone multiple times and still using, and they tend to get upset at that addict or frustrated with the addict, thinking that they're almost as if they're getting high or overdosing on purpose because they're continuing to need that kind of help. What would you say to the family members or friends or loved ones that are now feeling very upset that this continues to happen?
It's an important question, and I would say first and foremost that there is no evidence yet to suggest that having naloxone available increases abusing behavior or increases the behavior to use more and more opioids. For every case that you just mentioned, there's a counter case that says, once I had that naloxone given, that was like giving garlic to a vampire. That was the worst experience I ever went through, and I don't ever want to have to go through that again. I need to get into treatment. I would say to those family members, we've got to keep individuals alive long enough so that they can have professional medical treatment and get the help they need to get through this opioid use disorder disease treatment with the right treatment choices and get them off of opioids on a pathway towards recovery as soon as possible. And unfortunately, where we are today is if you can't get them past that opioid emergency, you may lose a life, and then they never had a chance. So that's how I look at this situation.
May I say you're probably one of the best spoken,
Exactly,
right, individuals that we have ever had on this show, especially from a pharmaceutical company. I mean, you're speaking from the heart, and I love your responses. They're so true to our industry. It's obvious you understand this space. It's obvious that you care. And I just want to, take a time out right now to thank you for that. Because you can tell by someone's answers.
Yes,
of course.
You know what I mean? And now I know why they got you to talk about it. Who else better? Do you have someone even better at your facility that can even respond to these? Because that's pretty nice, man. Thank you for that. You guys have any follow-up questions?
Yeah, I have a
Well,
couple.
you're too kind, I think. Go ahead.
Well, we have the one that we actually got for our foundation golf tournament with us in the studio as well. And I've noticed a couple differences, some that I actually kind of prefer on yours. I do like the injection aspect of it as opposed to the nasal spray.
You do?
I do.
Okay.
But the other thing I like is it says that you can refill it. How does that process work? Like, do you have to take it back to the pharmacy to refill it? And also, does that mean, does it have the same shelf life? In other words, does it expire and then you have to refill it then too?
Yeah, great question. So I want to hit 2 points there. The first is, how do individuals, if they haven't received this through a donation and it's not available in their harm reduction areas, how do they get this medicine in their household, especially if one of your viewers or listeners is sitting there wondering, well, I have a family member who needs naloxone. How can I potentially have access to this medicine? Kaleo is really focused on access, and so what we implemented was a very bold access program that ensures that all patients who have commercial insurance are able to access, are able to have access to Evzio for $0 out-of-pocket costs, even when your insurance company doesn't cover the product. And
Really?
for those who don't have government or commercial insurance, and you have a household income of less than $100,000, Evzio is available for $0 out of pocket for them as well.
Wow.
The way we recommend doing that is all you do is you go to our website, you download an enrollment form through what we have a direct delivery program, and then that becomes the prescription. And so a doctor can enroll the patient in a program, and Evzio is sent straight to their door by mail order.
Wow.
And that's how we handle both initial fills, but it's also how we handle refills, tracking the expiration date. Evzio has a shelf life of over 18 months. So when you're talking about this product, we really advise patients to every year have that conversation with their doctor about, do you have an opioid emergency plan in place? And do you have your naloxone solution just in case, just like a fire extinguisher, in case, God forbid, something were to happen and you were to experience, or a loved one was to experience an opioid emergency.
So this.
I've got to say I'm impressed.
Go ahead. Yeah. So
I'm impressed.
That means you, Trinity, can go right to the pharmacy. We can all three of us. You have commercial insurance, right, Robbie?
Yeah, I do.
All right, good. Your own?
No.
You still under mom and dad?
Yeah.
You stay that way as long as you can, son.
I know.
It gets more expensive, man.
Brother, let me tell you something. You better keep that insurance. Right. So all three of us have commercial insurance. You're saying, Dr. Edwards, that all three of us can go to the pharmacy and, by the way, we have a standing order here because of the state emergency, but is that only for Narcan or does that work for Evzio? Do you know if that in Florida?
To answer your question, yes. Unfortunately, because we're a small company and it takes a lot of time, as you all know from this show, to educate individuals, to
Correct.
get your product out there, to make sure they know how your access model works. Not all pharmacies stock the product yet. The ones that do now know how to access our access program. But if there's any question on what to do, the easiest way is to get it is through our direct delivery service,
Okay.
where it's a mail order straight to the home. The doctor sends in the enrollment form, which is found at our website at Evzio.com. It's very clear instructions there. For pharmacists, though, if you take a prescription in and a pharmacist says, your insurance doesn't cover this, or this product costs this much money, and you've got sticker shock because you're like, whoa, I heard from Dr. Edwards it's supposed to be $0.
Right.
The reality is it is $0. They just have not been educated on the process to make sure that happens.
You know, I'm glad you said that because I could have swore not too long ago, wasn't there some sort of media statement, something about people were upset about it being like $4,000 or $4,500, something like that, right?
Yep.
Yeah, and which was very, and you know who corrected me was not your guy Mark, because when we had our event, not only did Mark give us a call, but a physician friend of mine, an addictionologist friend of mine, called me up and said, "You do know that you could get this free, right?" And I was like, "Well, that's not what I had heard." And he goes, "No, you just haven't been educated." And he said exactly what you just said. You just haven't been educated by Evzio on how easily it is to access it. And so thank you for saying that, because I think we do need to publicize that a little bit more.
Absolutely.
And I think what it is we on the show, I think we need to go out and actually do this so that whatever we have to go through, when people ask, we can say, no, we did it ourselves.
Yeah.
Because I know how we got Narcan.
Yeah.
We called the company. They have a special rate for government and for government entities and nonprofits, and you had to pay for it. This one seems to be more geared towards private industry, which I love. Right? This is for the everyday people, correct, Dr. Edwards?
Yeah, I would say it's for, we basically have three different areas that we're trying to ensure access to Evzio. The first is for those who have health insurance who are taking opioids chronically. They have a lot of risk factors for an opioid emergency. They might have asthma or COPD or some other respiratory disease. They might drink alcohol. They might have a drug like Valium that they're taking for anxiety. Why Evzio was built to be a part of that plan. The second group, as you know, are those individuals who are in current active addiction treatment for an opioid use disorder. Every one of those patients, due to the risk of relapse, should have an opioid emergency plan in place and a form of naloxone. Obviously, we hope Evzio is that form.
Right.
And then the third is harm reduction. First responders, those who are on the public health side, who are reaching those who haven't even been able to get into treatment yet.
Right.
Those are the ones where we really target our donation and access program. And we really appreciate you bringing up the controversies in the media on drug pricing. Our whole goal was to create an access program to ensure patients can get this drug no matter what. And in this very complex healthcare system, we're having to navigate those waters to make sure that both the insurance and healthcare system does not pay more than what they should for our drug, and so we offer rebates and discounts, etc., as well as for those who don't cover it, the payer ends up being Kaleo. We end up stepping in and covering the cost of that medicine. So no matter what, everyone can get it for $0. So we appreciate you allowing that clarification, and it's just going to take time for us to get that out there among all the different media resources.
Well, along that note, we will leave it there. We appreciate that for sure. Now, the only thing we would ask moving forward is somehow, we do events all the time, and obviously, like we told you before, we did an event where we used the other product. We would love to do the next event with your product. At some sort, have that conversation and see what that would look like to have your involvement in one of our next events. Would you be open to that? I'm obviously putting you on the spot because we're
how we can
yeah.
continue to educate the community,
Correct.
your listeners, and all those that
Right.
you're involved in on our product and the Lockstone in general. You can't do this enough, as you all know. So
Right.
thank you for your efforts and for just you all taking such a proactive role to get out there to make sure individuals are equipped with the most up-to-date information so that they can potentially help reverse this increasing trend of unfortunately deaths in America. We're all in this together, and we just really appreciate the opportunity to speak to your listeners today alongside you.
Awesome, thank you. So remember, people, it's not just this product. This product is obviously good for the space that we've been talking about, but apparently this AviQ is also the same in that space. And we know that whole industry that's the scariest thing. I'm on planes and they say they won't give us peanuts because somebody on the plane has a peanut allergy. That allergy, the fact that you guys have that, I always, when I hear stuff like that, I'm like, thank God, of all the problems I have, I don't have that one.
Yeah, same here.
Because that has to be difficult to navigate. So between food allergies and addiction issues, this company is doing a lot of great things. Kaleo, are you publicly traded? Because maybe we just want to buy some stock in your company. Are you publicly traded?
We're private, but you can learn more information about our company at KaleoPharma.com. And again, there's information on our Evzio website, evzio.com. Just definitely appreciate the opportunity. You'll see us as a small company really working to bring innovation out there in areas where we see a clear unmet need. This was one that we thought we could play a small role in, and we just appreciate the opportunity to try to help save lives through this product and others.
He's one of my favorite people, man.
Isn't he so well spoken?
He's one of my favorite people we've ever had.
Yeah.
This guy is awesome.
Yes, I really like that.
Yeah.
Good job, Robbie, for setting up this interview. Our intern, Robbie, did a good job setting up this interview. I know that they were asking me all kinds of questions, and I apologize. I didn't want to answer any of them because I love regular conversation, but you were prepared no matter what. I love it. I love this. So thank you so very much, Dr. Eric Edwards. Thanks to Mark Poor, who connected us as well, and Robbie, our intern, who did that. Please, everybody, go to, what is it, KaleoPharma.com? Is that what it is? Kaleo, with a K, K-A-L-E-O, Pharma, Pharma.com, to learn more information. And by the way, people, I know there's a lot of physicians out there. Let's correct you physicians right now. Those physicians out there, they constantly say Evzio. It's not Evzio. It's Evzio. Now, apparently, I'm sure in the long run, we don't care what you say as long as you use it and prescribe it. But at least let's get the name right, Evzio. And thank you so very much, Dr. Eric Edwards, and everybody at Kaleo for this and for what you do. And we look forward to working with you a lot in the future.
Thank you all very much. Have a great weekend.
You as well. Goodbye. All right. So that was Dr. Eric Edwards. Man.
By far one of my favorite interviews ever. That guy was amazing.
That guy was on it, wasn't he?
Yeah.
Dude, he had like the perfect answer for everything.
For everything.
He even knew when to throw in the plug. Yeah, wow. Yes.
Yeah, that's
right
all.
on, man.
Guys like that deserve to be successful.
Yeah.
I mean, he's just normally successful.
Yeah.
And it comes from the heart. Did you hear him, people? I mean, it just comes naturally from the heart. It wasn't like it didn't sound scripted or rehearsed or anything. The guy knows.
It wasn't scripted because I had the questions.
And we refused to script it.
Yeah.
Great, Robbie. Thanks for bringing that up. I mean, we even got a thing that says, what was it say? Something like, what are the questions you're going to ask or something like that, right?
Yeah.
Or something like that, but whatever. And it's like, no, we just don't do that. And so he didn't need that.
No.
That was perfect.
He doesn't need that at all. The guy knows his stuff. He knows his medication. He knows why he's in this space. He knows why he and his brother got involved in the epinephrine space and the addiction space.
Well, I gotta say too, with all the media that's out there, with all these drug companies and big pharma, that one that was in the news of the guy who bought the company and raised it like 1,000% or whatever.
Right.
Like, I obviously, like you said, I don't believe it's an act. Like, it's nice to hear a drug company that seems to have some sort of moral code, like that actually wants to do good. They're in it for the right reasons. That's pretty cool.
Right, and I love that he emphasized we're little pharma without saying that.
Yeah.
We're little pharma, and there's a big difference, people. And I think that we also have to educate ourselves and not always be upset at big pharma, big pharma. You know what? A lot of people are alive today because of big pharma.
Yeah,
that's true.
I mean, as much as we can get upset or have issues with it, I think everybody in here has a product from some sort of pharmaceutical company in their house.
Of course.
I would say most everybody.
Unless you're living in the woods, then you have something.
And I've seen that guy. I saw that guy at the movies the other day with his kid. They both had hair longer than their legs. It was very cool, though. They had the surfboards on the top of their car. right there in Smyrna Beach, and I said, "Wow, man, that's a commitment. I can't have that lifestyle." They might not have any pharmaceutical products in their house,
No, maybe not.
Maybe not.
but at the same time, he's probably not shooting heroin and doesn't need this.
No.
So good for him. But anyway, wow, what a great interview.
Yeah, no, that was fantastic.
You know, if you guys missed it, if anybody's tuning in right now, tune into the Couch Live right now and missed the interview with Dr. Eric Edwards from Evzio from Kaleo Pharmaceuticals. The product is Evzio. Here's the product again. That's right. I was showing it to the microphone.
They can't see it.
You can't see the microphone, though. That's not where the
Now you're
video-
holding it up to the home. Oh, never mind.
I don't know what I'm saying.
You're good.
I don't know what I'm doing. But anyway, if you missed the interview or missed the entire interview and would like to hear it again, please, it is available, right, Trinity? And where can they listen to it again? Do you even know?
I don't. Is it up now? The
You don't know?
podcast?
It's up.
Oh.
The podcast is up.
Nice.
You know, I wish I knew how to get Robbie. I should have told you so you know how to give that plug because I don't.
We need to get it on iTunes too. I've had people asking
I
me
need
about.
to do the whole. My computer wasn't letting me for some reason.
Yeah.
I wanted to. Yeah. I'm not as with it as Dr. Eric Edwards. I don't have an MD and a PhD. Hell, I don't even have any D. There's no D. There's no D in anything
Louis
I got.
D.
Right? There's no D in anything I got. Just I'm the dope doctor. The dope. Just remember the first word right there is dope. Dope. So anyway.
I will say though that right off the bat, one I do know that they can go back on our Facebook page and rewatch
Right.
it later.
Right.
But I know we're working on the podcast on the couch.com.
And it's already done. I just I don't know how to refer you to people. Send me an email. Send me a thing. I'll tell you.
There you go.
But you can go to Facebook Live. It's facebook.com/the Couch Live,
Yep.
and you can watch the show. It's right there. We're filming it right now. Hey Paul, how you doing, Stella? And you can watch it that way and rewatch the whole thing, and you can learn about this product. All right, Trinity. Before we start doing our goodbyes and wrapping this show up, can we hear that one more time? That product one more time. This is what you hear, people. This is the tester for the Evzio product that we just had the talk with Dr. Eric Edwards, the founder, one of the founders, co-founder of Kaleo Pharmaceuticals, and they put out the product Evzio. Go ahead and hear if your loved one or friend is having an overdose from an opiate, or even if you think it might be an opiate. This is what the product will tell you when you crack it open.
This trainer contains no needle or drug.
You won't hear that.
Now,
If you are ready to use, pull off red safety guard. To inject, place black end against outer thigh, then press firmly and hold in place for 5 seconds. 5, 4, 3, 2, 1. Injection complete.
And there you have it.
and then he said there's an also thing after the real one that says
Seek medical attention.
right.
Yeah.
Red safety guard with white
Interesting.
case.
And you know what? I got chills that time when you played it. You know what I was thinking when you just played it? That how many people that was like right there when it did the countdown. That a few seconds later, their loved one came back to life.
Yeah.
Yeah.
That I just got the chills just seeing, imagining someone doing that, trusting this product, pulling this out and going, oh my god, oh my god, oh my god, shaking,
Well, we know it's
listening to
happened
that,
over 3,000 times.
yeah, sticking it, and then all of a sudden 5, 4, 3, 2, 1, injection complete, and all of a sudden their loved one coming back and going like, okay, stay with me, stay with me.
Yeah.
Yeah.
You're gonna be okay. We're waiting for the authorities. We're waiting. We already called 911. Just stay right here. Hold on. And then as soon as they get here, boom, boom, boom. Start explaining what's in the system. And let's get them to the hospital right away.
It's happened
That's
more
what I
than
started feeling right
over
now.
3,000
I got that
times.
chills right now thinking about
That's
that.
over 3,000 families.
And you know the sad thing, people. Everybody should have that. Everybody should have one in their possession. We carry around these. You know what? Now I need one of these. So I want both, Trinity. I gotta go get another
Well,
one.
we know how to do it now.
Because
for free.
I want to have that, because you never know when you're in that situation. But just to know that if everyone would carry this,
Yeah.
if everyone would carry this, you know how many lives would be saved? You know how many people would not have to die from this crap? And for those of you that are upset, I love his answer on that. You can't treat somebody who's dead. So you may be upset with the addict that maybe you feel like, you've been to 6, 7 different rehabs. You got revived 5 or 6 times. You just don't want it. You don't want to live. You want to die, blah, blah, blah. But if they're dead, they will never have recovery. And for some of us, we've died 1,000 times, but we're still alive today and we're in recovery today. And you know what? There's so many of us right now that if people would have given up on us, we wouldn't be here.
Exactly.
If we would have really given up on ourselves, we wouldn't be here. And trust me, I tried to give up on myself. There's a lot of people like me that try to give up on themselves and didn't even know that you were giving up on yourself. But at the end of it, now what? Our moms have their kids back.
Yeah.
You know, we're back. And so these life-saving medications, Evzio being one of them, it's a life-saving medication. It's absolutely critical. It's critical that you have one in your possession. If you own a business, your business should have one.
Absolutely.
If you own a gas station, a supermarket, a fast food place,
Yeah.
your bathrooms right now are being used for people to inject themselves every day already. Don't think that it's not. Don't think because you're in a high-end neighborhood that people aren't injecting heroin in your bathroom, because they are.
Not in my bathroom.
I've done it in your bathroom. No, I'm kidding. I was kidding. That was a joke. Yeah. But everywhere, in every public restroom, is an opportunity for someone to inject themselves with deadly opiates.
Yep.
So every business should definitely have one. All right. So anyway, let's close this up. 18 seconds left. Any goodbyes?
Nope. Just a big thanks again to Mark Poor for setting that all up. Great interview.
Perfect.
Absolutely.
Training? Anything?
I'm going night fishing tonight.
Night fishing. All right. My daughter got her first car. Done.
Uh-oh.
Kia Optima EX, fully loaded. Her car's nicer than mine. All of us, adios amigos. It's time for a taco. Goodbye.